So welcome back. Today we will be learning about polymyalgia rheumatica. The word itself is Greek, meaning pain in many muscles, and it was first described in 1966. It is a disease where the immune system is overactive the wrong way, we don't know why, and it attacks the hips and the shoulders, giving a lot of pain and stiffness. And even though it can look like a vasculitis, technically it isn't one. But in about 20% of those with giant cell arteritis that we just learned about, they can have symptoms of polymyalgia rheumatica. The symptoms are that pain and stiffness in the joints and pain especially with movement. So if the patient sits there and they don't move their shoulder, they actually are fine. But then the minute they try to lift their shoulder, that's when they get significant pain. But there is no weakness. And these patients can get swelling of the small joints, especially of the hands, the wrists. They can get carpal tunnel symptoms, and they can start to have symptoms for no reason, such as losing weight, feeling very tired, having low-grade fevers. How common is this disease? Well, it is one of the more common autoimmune rheumatological diseases, but it's still not as common as rheumatoid arthritis. You would need about 1,500 people in a room above the age of 50, because this disease by definition happens in those who are above the age of 50. You would need about 1,500 people in a room above the age of 50 for one person to have it. It is more common in women, and it is more common in those who are white of Northern European descent. As far as the diagnosis of this disease, just like everything else in rheumatology, it means listening to the patient and seeing if what they are saying is actually matching up with what is on their body, and sometimes doing tests to confirm the diagnosis. So in this case, looking to see if they have that significant pain and stiffness in the shoulders and the hips. Are they having pain with movement, but technically not weakness? And sometimes the blood work will show very high inflammation markers. And making sure that they don't have more common things such as thyroid disease or rheumatoid arthritis. The treatment for this disease is usually a small to a medium amount of steroids, just to calm that immune system down, and the disease goes away. And some patients do need what is called a steroid-sparing agent. So again, these are medications that do the job of the steroids, but without the steroid side effects. And in these patients also, making sure to prevent or treat any osteoporosis or diabetes is important. As far as the long-term outlook for these patients, it's actually very good. About 90% of patients will go into remission with about a year's worth of treatment. But some patients, it will relapse, meaning that the disease will come back. So it's about 1 out of 10 people, this disease will come back. Usually it comes back within that first year after treatment is stopped, but sometimes they can come back years later. However, now the patient at least knows what it feels like, so they can go to their physician right away. And in some cases, polymyalgia rheumatica can be what is called a paraneoplastic syndrome. So this means that there is actually a cancer on the inside that is irritating the immune system and making it overact and giving symptoms on the outside. So in these patients, an age-appropriate cancer screening is recommended, such as getting those mammograms up to date, getting screening for colon cancer, prostate, etc., chest x-ray, especially if a patient is a smoker, because you never know. As Dr. Alexander Fleming, the Scottish physician, would say, one sometimes finds what one is not looking for. Until next time.